Hi, my name is Rebecca and I'm the occupational therapist who's been working with your mother during her rehab stay. We've been seeing her following her broken hip, where she got a hip replacement for, and she is going to be discharging home at the end of this week. And so because of that, we want to make this transition super smooth to prevent any readmission, any further falls, any other injury, and give you guys all the information that you need to best take care of her. First, I want to talk about some precautions that the surgeon has set regarding her hip. Those precautions include not bending more than 90 degrees. So sitting in a chair, we cannot bend forward, but we can stay sitting upright. She does have a reacher that she can use to pick things up from the ground if she needs to. We have practiced that quite a bit in therapy, and she knows exactly what to do with that. So I think that she'll be good. Just kind of help her to remember to not lean forward in her chair and to use that reacher whenever she's getting dressed and things like that. To keep that 90-degree angle, like I mentioned, we cannot lean forward, but we also cannot bring our legs up. So we have to use the adaptive equipment that we have taught her for dressing. We're sending her home with a reacher, a sock aid, and a dressing stick, as well as a long handle sponge that she can use to wash her legs in the shower. She can put her socks on, she can put her pants on, take her pants off, take her socks off. Basically anything that she needs to do, she's able to do using that adaptive equipment. We just really need you to kind of be there and remind her not to lean forward, because it's a habit, and just like anything else, it's hard to break those habits. And so we just need that reminder to keep that 90-degree angle and not to lean forward. Another thing that we don't want her to do right now is to point her foot inward. I'm gonna scoot back so you can see me a little bit better. So if she's laying in bed, we want those legs straight out. We don't want one turned in towards the other leg. We want them both pointed forward and straight up. We do not want them turned in. That also includes when she's sitting, do not turn her foot out like this. That puts stress on that joint that she had replaced, and it's just not good for it. So that is another one of the precautions that the surgeon has set. Do not turn her foot in facing the inside. Another thing is do not cross her ankles or her legs. So I know I have a bad habit of sitting like this, like a lot of women do. And so it's really hard to break that habit. If you see her doing this, just remind her to keep her legs flat on the floor, facing forward, and that is going to really keep her hips safe by abiding by all of these precautions. I know these are hard to remember and they can seem a little bit overbearing, but we want to do everything that we can to keep that hip safe and to keep her safe, because like I said, we don't want any falls, readmission, or anything like that. Another thing to prevent falls and readmission and things like that, I want to talk about home modifications and things that you can do to kind of make the home safer for her to return. If there's any throw rugs that she could catch her foot on that could trip her, if possible, let's take those out. Okay, we don't want any trip hazards that could make her stumble, because her balance is still not where it needs to be just because that hip is so new. We want to take out any throw rugs, exposed wires that could be running across, like extension cords. If she has a small pet, maybe see if you can keep it for a little while, or see if there's someone else who can keep it for a little while she continues to heal up. Make sure there's adequate lighting everywhere, because we don't want her walking in the dark. And so this may include, leaving the bathroom light on at night, getting some night lights that are motion activated for whenever she has to get out of bed. Her foot's gonna kind of activate that motion light, so she has some light while she is walking. Remind her to leave on her bedside lamp or something like that, to where she has adequate lighting and can see where she's going. And that is also going to help reduce the risk of falls. She has been trained in using a walker while she's at rehab, and she will be sent home with a walker as well. So safe walker use is to never pull from the walker whenever you're standing up, because that walker can tip over and you can kind of plop back, and we don't want that at all. So instead, I want both hands on the surface she's sitting on. Remember, push that injured leg out. It's just her right leg. We're gonna push that right leg out so she's not breaking that hip precaution. Push that leg out and then have her stand up and then hold on to the walker. This is going to make her safer because she's not pulling on that walker and that could make her trip. So we always want her to put her hands on the surface she's sitting on, prop that right leg out, and then push to stand up, and then grab the walker once she's all the way up. And then to sit down, we also do not want to hold the walker because it's not a stable surface whenever you're kind of pulling on it like that, and it can tip over and she could lose her balance. So whenever she is sitting down, I want her to keep one hand on the walker first, reach back, then reach back with the other hand until both hands are on the chair, and then sit down. This is going to have her hold on to the stable surface, and that is going to just make sure that she is overall safer and is not gonna have any mishaps with that walker. She's done really, really well in rehab, and I think she is safe to go home, but we wanted to give you all of the information that we can. That way you can give her those cues and reminders to follow her hip precautions, and you can get her house set up for her. We've also recommended grab bars in the bathroom, which she may already have. We have not seen her restroom at home, and so this is kind of our advice to you, and we just want to make sure we cover all of our bases. We're recommending grab bars beside the toilet. That way she can hold on to that to stand up instead of trying to stand up without holding on to anything, because that is a low surface. If possible, we would also recommend a raised toilet seat that goes above the toilet. That way she doesn't have to sit down as far and it's not as hard to get up. And we would also recommend a shower chair because standing in the shower can make that leg really tired, and that shower can also get slippery, which can increase her risk of falls. So like I said, if you guys already have those, perfect. If not, contact our social worker and she can tell you some resources of how you can get those, okay? If you have any other questions, I will attach my email address to this video and you can reach out to me at any time. Thank you so much.